For individuals that have a stoma and are in need of an endoscopic evaluation, there tends to be two key reasons that those individuals are pursuing the procedure. Sometimes it would fall within a screening lens. So for example, trying to prevent colorectal cancer, or perhaps other indications would be more for a diagnostic purpose.
So an ostomy is an opening where they take the bowel, like the small intestine or the large intestine, and they bring it up through the abdominal wall and make what's called a stoma. So they'd be the end of the bowel, and that's where fecal matter will drain through. So say someone, have your general screening for a colonoscopy. Instead of going through the bottom, they're gonna go through the stoma instead for that screening. It's gonna be similar to doing a prep for a colonoscopy.
For individuals, for example, with ulcerative colitis, they may have had their colon removed and they're marching towards a separate surgery called a J-pouch creation. So for that individual's journey, they may have a temporary ostomy, so a temporary bag affixed to an outside of a stoma. In time after healing, that would be brought down.
We can have little kids, babies, up into people in their 90s. No one is immune from the potential for getting a stoma. So we have to kind of tailor our care and our education to make sure that we can meet the needs of all these different patients.
So for the individual checking in for the procedure, we would anticipate for them to be escorted back, change into a gown, and for an IV to be placed. Now it's through that IV they'll receive fluid as well as sedation, but before receiving any sedation, they would meet with their procedure team to review some of the details. Now for individuals that have a one-piece, that entire system will come off. For individuals that have a two-piece system, just that outer bag will come off. So that's when we then start our inspection of the stomal opening. Now that gives us an opportunity to see if there's narrowing as well as a sense of direction. So this is one of our endoscopes. So as you can see, it's a very narrow, long tube that would go along the length of the stoma, and we're able to help navigate our direction with these different knobs to change the angle of the scope, as well as use torque in order to see the inside of the intestine.
A lot of patients that come in very nervous, tearful, anxious about getting a stoma. There's going to be an adjustment period. You will get there to the point where you're going to live life every day and it's not going to be a burden on you.
One important thing for folks to be aware of after the time of endoscopy is realizing during the endoscopic evaluation we'll use water to help clean the inside of the intestines, and we often use air or carbon dioxide to inflate the intestines. So after the procedure, they may have some liquid that promptly accumulates in their bag or air.
We do have a couple options for patients. We have what's called an irrigation sleeve. It's just an extended sleeve. It has more capacity, so it can help manage that higher output so patients have less frequent trips to the bathroom to empty out their pouch. Following an endoscopy through a stoma, I would recommend at least bringing a couple sets of supplies with you for after the procedure so that you don't have any risk of leaking afterwards. Also, you need to have a ride home, and we wouldn't recommend driving within 24 hours after having that sedation.
I think one of the unique things that we offer in so much of our care is a multidisciplinary approach. So we have a wonderful force with our ostomy nurse team that walk folks through so many important dynamics of stomal care. We have experts when it comes to colorectal cancer as well as the associated procedures. And then as us gastroenterologists who offer that unique lens to ensure the specific need for the individual is met.